Good morning, everyone. Or actually, good afternoon. This is Dr. Rebecca here at North Star Chiropractic, and today I am joined remotely by Amanda Powell, who is a certified doula as well as a certified lactation counselor. And she's also the owner of the business Small Packages. I had the pleasure of meeting Amanda in person last week in Portland, and she's really somebody that you guys need to know, and so I thought I would bring her to you live today. Um, and as many of you know, I am certified in a special technique for pregnant women known as the Webster technique. And we're both very passionate about improving birth. So again, our work really coincides. Okay, Amanda, could you first please introduce yourself and tell our viewers a little bit more about what exactly a doula does?
Yeah, so again, I'm Amanda Powell, and I live in Portland, Maine here. And I've been a doula for 5 years and a lactation counselor for 3. And a doula is essentially a support person before, during, and after birth. We provide emotional, physical, and educational support. I like to think of it as like a combination between an event planner and like a trail guide. So we discuss all your options with you, but you make all the final decisions around them. And so it involves me meeting clients prenatally to go over what happens during labor and birth and what other options are, because a lot of people don't know how many options there can be during labor and how many, questions they might have. And then we design what I like to call birth preferences, because some people call it a birth plan, but it's really hard to plan birth. So I like to give it that idea of, more preferences. And then we discuss things to do in pregnancy to have a better birth, and we discuss fears and how to overcome them. And then at the birth, I'm a constant support, giving advice, helping with position changes, and emotionally coaching them through the process. And I'm there for the whole birth. I usually stay a couple hours after to help with breastfeeding and just get settled. And then I do 1 or 2 postpartum visits to talk to them about their birth story and help them adjust after the birth.
Wonderful. And that is so important. And I think oftentimes that kind of falls by the wayside because, of course, birth is this huge event for everyone involved. And then afterwards, sometimes families are sitting at home and like, oh my gosh, I have this whole new human to take care of and my body is changing. So that's so important. And I'm sure your clients really appreciate that. And speaking of clients, could you tell us why someone specifically would hire a doula and who is your typical client?
Yeah, so the studies for doulas show that having a consistent support person in the room changes birth outcomes by decreasing the use of pain meds and decreasing C-section rates and increasing positive birth outcomes. And so a lot of people also don't know that doctors and midwives can be in and out of the room. They're really only in there when there's like a decision to be made, or sometimes they check in. And then nurses are in there more often, but they have a lot of charting to do, and it can be hard for them to be a full focus, and also they switch shifts. So having that doula 100% focused on you and your partner and around the whole time is what people find a lot of benefits from. And on the partner part, I would say they feel a lot of relief having a support person there to assist them because, they're a support person, but they're also becoming a parent, and so it can be a lot of pressure for them. And they don't always know what's normal. They don't always know like how they can help. So I never replace a partner. I only help enhance their involvement and connection to the process, which is actually one of my favorite parts about it.
Certainly, yeah. And I remember you talking about that a lot during our meeting. And again, I think that people would really appreciate that. I know my husband in the future certainly would probably need someone to be like, wait a second, is this normal? What's happening? So
Yeah,
that's
it can be really
wonderful.
helpful.
Yeah. And so could you tell us a little bit why specifically you chose to become a doula?
Yeah, so not to be cheesy, but it almost doesn't feel like I chose it. It feels like this is what I'm supposed to be doing because I've always really been into pregnancy. And I always just thought it was something that I was really into. But then in college, I had a professor that convinced me to design my own major because my college it was really great. They let me do that. And so I designed my own major focusing around pregnancy. And that's when I found out about doulas. I didn't know about them until then. And I was like, oh, this is great. Like I can be a part of this birth process. And so that was about 7 years ago that I first took the training. And, ever since then, it's just been really great to be able to be a part of people's birth, which is such an honor to be a part of.
That's a huge part of someone's life, so I can't even imagine the impact you have. That's wonderful. And going off of that too, what would you say is your favorite part of the job?
So I would say connecting with people and helping them find their empowerment during the process because
Mhm.
it's really easy to feel alone. And I want people to know that they aren't alone and there's a really large supportive community waiting for them. And I truly believe that it takes a village, and the more connected that we feel, the more we thrive. So if people have a positive birth, they go into parenthood feeling that confidence. And so that's what I want to help them in that way.
That's amazing. Yeah. Awesome. And then could you tell us a story about a satisfied client of yours?
Yeah. So sometimes clients turn into friends, which is really great.
Yes.
So I have a client from 3 years ago, and we have a really amazing connection. She hired me because she knew that she needed someone to support her and her partner differently. You know, they had kind of different needs and different personalities.
Mhm.
So she felt like I could help her with that. And then I also bring a lot of humor to birth and pregnancy because it can be really stressful. And so I
Yes.
really like to bring that when it's appropriate, obviously. So she appreciated that. And then she did go past her due date, you know, which is common, but I helped her with questions that she could ask her OB after or during that time that she maybe wouldn't have thought of on her own. Um, and then when she wanted to talk about pain meds and interventions options, she felt like I didn't have any judgment around that, and I just helped her talk about all of it. So we've stayed really connected, and she even got me a gift after the birth, which I was
That's
like, oh,
awesome.
thanks. And
Yeah.
yeah, one of my favorite cookbooks actually that she gave me. So
That's a great gift.
yeah, so we've
And you
been
gave
doing
her the
this.
gift of feeling supported during her birth, which again is a huge part of someone's life. So that's
Yeah,
amazing.
yeah, it was great.
Very cool. Also, do you happen to have any offers that you'd like to offer our audience that's listening right now?
Yeah, so I would like to add a prenatal or postpartum visit to my package if anybody, you know, gets a referral from this. So I'd really like to do that.
Wonderful. And that's amazing. Again, with the support that we talked to, that's just an added level of support. And again, I know that your packages are already so supportive, so that extra level is going to go the extra mile.
Yeah.
And I just want to say thank you so much again, Amanda. I know that it was a quick interview, but I think that it's probably going to inform a lot of people. I know that I've had a lot of questions just about what is a doula. So I hope that we answered that for the people that are listening. Again, if you have any more questions, please feel free. I'm going to tag her Facebook page in this post, so go ahead and follow that and like it, as well as I'm going to put all of her email and her website in the comments. That way you can follow up that way as well. Thank you so much again, Amanda, and I'm sure we'll be talking again soon.
Yeah. Thank you so much, everyone.
All right, bye-bye.
Bye.